Welcome to my first Friday message of 2023 and a very happy new year to everyone. I hope you all had a wonderful and restful break. In 2023, we'll be continuing our Friday messages to keep you informed and are working on some modifications. We'll take advantage of the extraordinary and broad expertise in the School of Medicine to address a number of pertinent health topics. This week, in light of the event in the NFL 2 weeks ago, when the whole country was transfixed by what happened to Damar Hamlin, a football player in the NFL Buffalo Bills, who suffered a cardiac arrest, I've invited Dr. Christopher Granger to discuss strategies for cardiac resuscitation outside the hospital. Dr. Granger is a practicing cardiologist and professor of medicine who serves as the chairman of the American Heart Association's Mission Lifeline program to improve heart attack care nationally, and also on the American College of Cardiology American Heart Association Guideline Committee for Heart Attack Care. Before we talk to Chris, I'd like to give you a brief update on COVID at Duke and in the community. As anticipated, there's been a post-holiday surge of cases of COVID and other respiratory illnesses. Case rates in North Carolina, unfortunately, are among the highest in the United States, and reported cases, hospital admissions, and emergency room visits for COVID symptoms have all increased across the state. A week ago, the CDC moved Durham County to a high-risk category. Currently, there are more than 140 individuals hospitalized with COVID in our health system, and testing across Duke shows a 12% positivity rate. Unfortunately, a number of our critical workforce in Duke Health are out due to COVID and other respiratory illnesses. Factors contributing to this increase certainly include holiday gatherings and travel, but in many areas of the country, it's also being fueled by a new variant, XBB 1.5. This variant, which is a recombinant of two Omicron variants with an additional spike mutations, is highly infectious, but not more virulent. And while it still constitutes a minority of cases locally, it is increasing and dominant in other areas of the country. So I want to remind everybody that if you have cold-like symptoms, please stay home. Remember that home rapid antigen tests for COVID sometimes provide false negative results during the first few days of symptoms, so you should remain at home. Also, make sure you and your family members are up to date in the vaccinations for COVID, including the bivalent booster, as they remain the best protection for severe illness and hospitalization. Regarding masking, since Durham is now a high transmission community, it's time to mask up when in crowded public spaces and to physically distance, particularly when eating indoors. These strategies are particularly important for those at high risk for illness and are consistent with CDC guidelines. Thanks to all of our faculty, staff, and students for your resolve to protect yourselves, your loved ones, our health care workers, and our community. And now I'd like to welcome my special guest, Chris Granger. So Chris, thanks for joining us and Happy New Year. In my introduction, I talked about the nation witnessing on live NFL coverage the cardiac arrest of Damar Hamlin during the Buffalo Bills game. And the excellent news is that he made a remarkable recovery and on Monday was discharged from the Cincinnati hospital and flew home to Buffalo. An outcome undoubtedly due to the rapid response of his trainer and his team. So I'd really like to talk about what are effective interventions and who can do them. So let's just start out with the numbers. So Damar is a fit football player. It was quite unusual, but can you talk about the incidence of cardiac arrest outside the hospital in general?
Yeah, Mary. So thanks for this opportunity to talk to you about this. And I think it's remarkable how much attention this has gotten, and we want to leverage that to make sure that we all are kind of up to date and know about the importance of early response to save lives for cardiac arrest. So here's one guy who has a cardiac arrest in the past 10 or 20 years on a professional football field that gets this huge amount of public attention, which is terrific. But even more important, there are 1,000 people each day in the United States who have out-of-hospital cardiac arrest, and only something like 8% of them survive. He had a trainer. It wasn't really a medical person. Anybody can do hands-only CPR, who recognized that it was a cardiac arrest and began good quality CPR. And then they found an AED. And before the ambulance even came onto the field, he had the AED applied and had the defibrillation occur. And that's exactly what we're trying to do more broadly in community response to cardiac arrest.
So can you talk a little bit about how important speed is in terms of getting a good outcome?
So it's so important. And what we estimate is that for each minute of delay to definitive care, within good quality CPR can make that somewhat longer, but each minute of delay, there's a 10% decrease in survival. So it's all about the first 10 minutes. So the bystander has to call 911 once a person is collapsed and is unresponsive, start high quality hands only CPR, no mouth to mouth, until help gets there. And ideally, somebody might know that there's an AED nearby, but otherwise, first responders will arrive. And one of the things we're trying to do in North Carolina in our race cars trial that we're conducting, funded by the NIH, is to get first responders optimized too in terms of how quickly they arrive at the cardiac arrest with an AED in hand.
So you've been looking a lot at how we can engage and train members of the community, household members, in interventions. How successful is that?
So it's a good question, and we don't know yet. We're testing this in this randomized trial. Cluster randomized includes coverage about 8 million people in North Carolina, our trial. We're looking to places like Denmark, where they've done a remarkable job. 80% of people are trained in bystander CPR. You can't get a driver's license unless you have. And
Wow.
Most employers have, as part of their yearly training CPR, hands-only CPR to all their employees. And then we're looking at schools and churches and government and healthcare organizations like Duke Health to promote the idea that everybody who works at the organization should know hands-only CPR.
So a lot of clinical research has moved the needle here. I know certainly that has been some of the data behind getting defibrillators in the community. Can you talk a little bit about that?
So defibrillators strategically placed in the community with good signage and linkage to the 911 dispatch center can be really helpful. Even more important may be getting defibrillators in the hands of first responders. So in North Carolina, and this is especially an issue in rural settings, that about half the time a fireman will arrive at the cardiac arrest and not even have an AED in hand. So we're also trying to get more AEDs in the hands of the first responders.
So what are the take-home messages that you want everybody to know?
So the key take-home message is that death from cardiac arrest is largely preventable if bystanders know and perform CPR and AEDs get there quickly to defibrillate the patient. And I think we can do much better, including in North Carolina and most parts of the United States, if we work with communities to set up systems whereby people know CPR and AEDs get there quickly.
Well, I think we were all thrilled to see that Damar Hamlin had that early intervention and the outcome was so positive. So hopefully that's news that you can use as you really push the agenda in the community. So thank you so much, Chris, for everything that you do. And thanks for taking the time to talk to me.
Thank you, Mary.
I want to end by recognizing Martin Luther King Jr. Day. On Monday, we commemorate Dr. King's life and legacy, and I encourage everyone to take the time to reflect and renew our dedication to making his dream a reality. That is not the work of a single day, of course, but of every day. And at the School of Medicine, we're committed to becoming an ever more equitable and diverse institution and ensuring that everyone in the Duke community feels valued and important. Thank you to our faculty, staff, and students for embracing this essential mission. Yesterday, you received a powerful message of hope and encouragement from Kevin Thomas, our Vice Dean for Equity, Diversity, and Inclusion, that included information about the many activities and events at Duke and in the community to honor Dr. King during the coming week. I encourage all of us to participate as we can and to find meaningful ways to remember and honor Dr. King's vision. Thank you for joining me today. Stay safe and have a great weekend.